I want you to know what some of the medical procedures are and the facial and the neck procedures that transgender people have. So when they come in to see you as a dentist, you'll know what they're talking about. Then we're going to talk about the Texas Dental Code, and then I'm going to have suggestions for the dentist and the dentist office, and we're going to close with questions and answers. And again, my objective is to help you get an increased understanding of what it means to be transgender, and so you can be knowledgeable about the procedures. But most importantly, my objective is that you'll be in a place where you can realize how important you are as a professional and how much this population needs to be able to go to you and feel like you get them. Because remember, people are always going to remember how you treat them. And when you're being treated in a way that's not so positive everywhere else, coming to see a healthcare professional is really, really important. And I believe if you have that, it's really going to up your whole practice and your vision and hopefully your own integrity of yourself as a dentist. So, okay, so why now? Why all this interest about transgender? Why is it coming out? So in 2015, there were, nope, not that one. I think I can do this, right? Can I hit the, no, we're not on that slide.
Okay.
We're on the why now. Thank you. Okay. What percentage, why now? So in 2015, there were 700,000 reported transgender people in the United States. 5 years later, now in 2020, we have 1.4 million people reported. Now, let's keep in mind it's probably a lower number because people are so upset about transphobia and discrimination. Okay, but it's doubled in 5 years, or at least the awareness of it. Okay, we have about 15,000 people in the military that are trans. Trans individuals today can still be fired or denied employment for their identity. 26% of trans people have lost a job due to their identity. And yet there's a big interest. Remember when Caitlyn Jenner was on the 2020 show? That show had 4 times as many viewers as any other show. And it was 16.9 million people. So it's really quite interesting what's going on there. But unfortunately, states, we only have protection in 32 states for transgender people, and transgender people can still be denied employment and fired because of their identity. So many of you may have a neighbor who's trans, or your kid goes to school with a kid who might be transitioning, or you know someone. You may have filled out a medical form somewhere, and hopefully I'm going to get you to do this, where you have not just male and female. I know Methodist Hospital on Fannin now has male, female, gender non-conforming, other. They've expanded that. But it's very exciting because we're giving this language. And when you give something language and say, well, we have a word transgender, it validates the reality of its existence. And it gives us a framework to develop our understanding and awareness. Then we have protocols for treatment. So it's kind of like AA. Remember in the 1930s, Bill W., who was a stockbroker, and Dr. Bob, who was a surgeon, got together and started talking about alcoholism. And within a short period of time, they had more and more people saying, this happens to you, you feel this way, same thing happens to me. People certainly drank and got drunk before 1935. But when they got together and formed AA, it gave it a language by which now 90 years later, it's a household word. You can say, oh, my mother's in treatment, or my brother's alcoholic, or I'm going to an AA meeting. Nobody blinks an eye because we understand it's a condition or a disease. So with transgender, it's kind of similar. It's coming out, not because it hasn't existed, but because now more and more teenagers, adults are writing books, they're telling their stories, there are more and more people identifying. It's powerful. So even though in some places it's being more, there's more of an interest, it's being more understood, we still live in a world with a lot of discrimination and fear, to the point where people not only have hate crimes and discriminate, but murder people. So that's why it's a very misunderstood population. And as dentists, for you to understand better, you're making a big contribution to the world. And I was thinking too, what if somebody comes in and they're riding their bike, they fall off their bike. Let's say you have a 30-year-old woman, made some of these up. She clearly needs bonding or caps on her front two teeth. And she says to you, my face is still swollen. I had feminine facialization surgery 2 months ago. You want to be able to know, what does that mean? How many surgeries did they have? What part of her face did they work on? Or you can have somebody that comes in with an abscessed molar and you see the abscess, but their whole face is blown up. And you're kind of wondering, like, is that because of the abscess or is there something else going on? And they say to you, I'm transgender and I had electrolysis 3000 4 days ago. You want to know what that is? Male to female transgender people have electrolysis, obviously, but it's not the same electrolysis the rest of us would get. So you want to understand, almost all of them have it a certain way. So you want to understand that. You may have someone who's female to male, and they, as I did, and they came into therapy and they said, we were talking and they said, I had a double mastectomy 5 days ago. And I said, 5 days ago? They lifted their shirt before I could say, no, I don't need to see. They lift their shirt, okay, and this person's sitting there with drains. Now, I'm sitting a few feet away, but as a dentist, you're working on somebody and tapping them, perhaps. You want to know who's sitting there with drains. I didn't even know a person could walk with drains. Not everybody that has a mastectomy has drains, but some of the doctors who do male breast contouring do use drains. So it's something you would want to know about. What if you have a 16-year-old, okay, and her name is Amanda, her legal name is Amanda, and she sits down and you look at her and she's 16, she looks kind of androgynous, and she says, please call me Oscar. I'm transgender, and that's what the teachers call me. That's what my friends call me at school. Are you going to call her Oscar or are you going to call her Amanda? So let's say you call her Oscar, okay, and then you're done, and the mother comes up and she looks at you and she says, well, how did she do? How are you going to respond? Are you going to say she did well? Are you going to say he's fine? Kind of puts you in that kind of odd space. And then what if you walk into a new, I want to say client for me, patient for you. You walk into a new patient who's sitting there and, he clearly has on a business suit and he took his jacket off and it's got the little thing here, and you pick up the chart and the chart says Diane. And you're already walked up to him. You hadn't looked at the chart before, let's just say. And what do you say? Do you say, excuse me, I think I have the wrong chart? Do you say, they put a chart here with the name Diane on it, and wait for the patient to say something? Because that could happen. You may have people that they tell you to address them by name, or they write down a name that's not the one that you think they should have, but it gets kind of tricky. So I think you're going to be experiencing all of this, and that's why I wanted to bring it up. So, okay, let's start with, what does it all mean? We start with the first third. It's just about, nope, we're not doing that slide. The next slide, please. Oh, thank you. Okay, what does it all mean? Let's get to the basics of what transgender means. The first one says sex versus gender, okay? Sex is not gender. Sex is what we're born with. It's our physical anatomy. So when a boy is born, we say, oh, he has a penis. We say, oh, it's a boy. He has a vagina. It's a girl. Sex is determined totally by anatomy. So it's really funny to me when people have gender reveal parties to tell whether it's really not a gender reveal. It's a sex reveal party, because that's what sex is. Gender is how you feel, how you emotionally and mentally relate to the body to your birth sex body. Okay, and many of us it's completely congruent and we've never thought about it. I have a body of a girl, I feel like a girl, end of story. But there are many, many, many people that have a body and their gender does not match. Now, some people it doesn't match 100%. Some people it doesn't match 90% or 80 or 10%. So there are different degrees of that too. So let's keep moving. So it says gender identity. That's how we relate. I'm female. My gender identity is female. It's comfortable for me. I have a female expression, my clothes, how I look. Some people are gender non-conforming. It means they're not binary. They don't really conform to male or female. They're sort of androgynous. Gender variant, similar, same. They could go either way, kind of a Boy George kind of thing. Gender fluid, people might say, the president of the Transgender Foundation of America will say, well, one day I feel like a boy, one day I feel like a girl. He's a contracted engineer in oil and gas, and he goes to work as a male and does his home stuff as female, and it works for him or her. Non-binary is neither male or female. And cisgender, the word cis comes from the word cisgender, which means your body and your brain match together. Okay, let's keep going. If you have questions, write them down. We'll get them at the end. Thank you. So transgender people, the term is called gender dysphoria when it doesn't match, okay? And we say that's a condition. It's not a disease, it's not contagious, it's not an illness, it's a condition. And these are people who have gender identity different, but look what's in italics, who are distressed by it. You only have gender dysphoria if you're distressed. There are some people, maybe some men, they like their female side. They're a little bit effeminate. They're not gay. They're straight, but they're a little bit effeminate. They like it. They don't have gender dysphoria. You have to be distressed by it to have the condition. Okay? So when we have a condition, what do we do to fix it? Well, we want to correct it. So to correct somebody that's in distress about their gender, we do transition with a transition. And the transition is a term used to, there's two kinds of transition. We have social transition and medical transition. So like with teenagers, you're going to see a lot of social transition. And what that means is someone's going through a change to the opposite gender, but they haven't done anything medically. They haven't done anything to change their body. They haven't taken hormones or done surgery. So a social transition might be a girl who has a boy haircut, wears only men's clothes, binds her breasts so she's flat, and has everybody at her high school call her by her male name. That would be a social transition. She hasn't made a medical transition. It's funny because people will say, well, how do you know if you want to transition? You know, because most of us are on a journey of self-discovery, and teenagers in particular. For many teenagers, this doesn't come out until puberty. Maybe as a child, some kids, you know, boys will be girls, girls pretend to be boys, whatever, it's storybook. But often at puberty, those who are really transgender struggle because now their body's changing and they can't get away from the fact, they can't fantasize the fact that they're not what they are. So then it becomes a real serious thing. You know, and I have a lot of girls tell me that, you know, as soon as they got their period or breasts, their life went downhill and it wasn't who they were. And I have boys tell me that, men tell me that they would go to sleep wishing that they could wake up and not have a penis. So that's kind of how it expresses itself. Can we do the next slide? We have a picture. Thank you. As you can see, can you see my little arrow? No, on this pointing to the man? No? Okay, I can't hear you. So, okay. This person clearly had, if she said, did they have a social transition or medical? I would say a medical transition because of the beard. Okay, that's facial, that's from the testosterone. That's what happens. Men get the beards. The trans men get the beards. This person looks like they have had chest surgery. It's not the same as a mastectomy that someone would have with cancer. When you're transgender, you go for the removal of the breast, but also male contouring with little pecs. They move the nipple. They make the nipple smaller. Trying to think what else. Often, female to male men lose their hair because of the testosterone. So he may have had some hair loss. But you can see this is kind of basically how it looks with a male transition. All right. Next slide, please. Okay, so with female to male transition issues, I will say female to males can transition very much so, almost 100% within 6 to 9 months, okay? Because testosterone is very, very strong. So if someone comes to me and says, I want to transition, and I've done an assessment and they're going to start hormones, they pretty much have to have breast surgery and a name change at the same time because testosterone works so fast. You'll have acne on your face, facial hair, thicker neck, muscles will get bigger, clitoris enlarges, you have all these changes immediately. And within 3 months, your voice will drop permanently. 3 to 6 months, but it's closer to 3. So people have to be very, very, very sure, which takes me to something else I want to explain. You might say, wow, that's really huge. So how does someone do that? There's an organization called WPATH, World Professional Health People Association for Transgender Health. And I'm a member, and they are in charge of everything that's going on in the world for transgender people. So if someone comes to me and they want to transition, I have to do a full assessment. It's about 10 pages and a lot more. So it's very well documented. There are steps to take. I have to make sure they're psychologically prepared, they're practically prepared before I would ever write a letter for surgery or for hormones. I follow the WPATH standards. They write the standards of care for therapists, how to respond to patients. They're the ones that work with the insurance companies. The VA hospitals now will pay for gender surgery. They're the ones that tell us what to put in the letters. They're the ones that are working with the DSM. Is this a diagnosis? How are we going to write it in the book? They're the ones working with the school system. How do we talk about transgender in elementary schools? They are in everything. So somebody probably could go to a doctor and get hormones off the streets. That's always going to happen. But the rest of us have very well structured standards of care that are constantly being revised because WPATH is a world organization. They're very organized and there's committees for everything. So as a member, I probably get about 10 emails a day, the latest in the world of transgender, medically, emotionally, politically. It's very powerful. So it's not something that you can just do. And I want you to see that somebody wouldn't do this just to fit in somewhere either. This is a long, hard road. Okay, so female to male transitioners, they bind their breasts, wear a couple of sports bras. It's very bad for teenage girls. Sometimes they can't move their arms. So they certainly don't go swimming, or teenagers that bind don't want to do gym in high school. So it's a real factor there. They take testosterone, they have the chest surgery, you have to decide what kind of surgery to have. Do they have genital surgery or not? Does a female to male have a hysterectomy? They won't have periods because the testosterone will override that, but they still have a uterus. Can a transgender man get uterine cancer? Well, yes, if he didn't have a hysterectomy. So that's now a big insurance question. Do you freeze your eggs if you started out as a female? Many people do, and there are a lot of emotional considerations. But right now I'm just going over the physical. Okay, can we do the next slide? I wanted you to see this trans man under his breasts where they do the incision. You can see lines where he's still healing. You can see lines around the nipple. Some may have had some tattooing, maybe some chest tattoos to cover the scars, but a lot of trans men don't want to cover the scars. They're kind of proud of where they've come from and what they've done. But typically, this is what trans men look like, very masculine. So if there's ever a law that you have to go to the bathroom of what you were at birth, I think it would not work for most people to have this guy walk into the ladies' room. So a law like that would not only discredit who he is, but it would make it very uncomfortable for other people, yet some people really want that kind of a law. So, okay, next, male to female transition issues. And this is where I think it's really important for dentists. Okay, so obviously, to go over the issues, it's a big step. They leave their male privileged life, you transition on the job, you go through laser hair removal. If I had, some hairs on my chin, I could go to get electrolysis anywhere and they would do it. Men who transition to women, it's really difficult. You have thick beard, usually, particularly if you're an older adult, you've got hair down your neck, not to mention the complete body hair electrolysis that's done. But there's a place outside Dallas, it's called Electrolysis 3000. Probably almost all my female to female clients have done it, because they will numb you like a dentist. They'll numb both sides of your face, and then you have people working on each side, and they'll do a full face. It takes about 8 hours, and people need to have that done at least 6 times to make significant difference in the hair. So it's a big deal, and it's painful. And I've seen people plenty of times, like the day after, they'll come to therapy. But it's not easy. And as a dentist, if someone had it and they were, especially if they were fair skinned, if they're fair, the swelling is pretty amazing. So, but no, they do that because it's just too painful to actually have your hairs poked out from certain parts of your face where you have a lot of nerve endings. Male to female transition, they have to think about facial feminization. Now, facial feminization is a big issue because pretty much most male to females need the basic Adam's apple and the nose, right? I would say that's basic. But what most people do have, clearly they have the occipital shave. This bone up here, I'm sure you all know what it is, but it sticks out more for men, so they have to shave this bone so the profile will be more female. They shave the point in the chin, in the jaw, because men have pointier here. They will do a lip raise, because in general, when women talk, you see their top teeth. When men talk, you see their bottom teeth, something you might want to check out when you go home, look at your family members. So it lifts so you can see a little more of the top teeth. And typically they'll have a brow lift where they pull this back, pull the hair forward, and the eyebrows up. So that would be a full FFS, feminine facialization surgery. There are people that do it in Houston, and there are certain well-known people in the United States. The biggest one is in Spain. I've had clients go to Spain, and they look amazing when they come back. And it's very natural. And it's between $40,000 and $45,000. So typically, genital surgery for male to female is about $25,000. You could get it for less if you go to Thailand, which is one of the state-of-the-art places in the world. They get it for about 18. So your face is almost double, and your electrolysis is costly as well. So it's not that the genital surgery is so expensive, but people think that. But there's everything else that you have to do with it. So I'm just trying to give you an idea of what it's like, because it's not easy. Okay, then there's hormones, voice coaching, gender. Not everyone has corrective surgery. Sometimes there are men 65 years old, they're married, they want to live as a woman, but they don't want to have the gender surgery. Some people have medical problems, they can't have genital surgery. So it's not for everybody, but for most, definitely for young people. Some people just have the orchiectomy, which is the testicles removed, or vagina, and then after you have a vagina, if you have a vaginoplasty and they make that, you have to dilate for several hours a day for months afterwards. And do you consider sperm banking? A lot of my teenagers do sperm bank because they don't know what's going to happen relationship-wise. Okay, so can we move on? We won't do this slide because of time. This is Kim Petras. She's 16 years old. She's the youngest person in the world to have genital surgery. She's now a pop singer, and she's well known with a lot of teenagers. So when they interview her, this is a TV show, and basically she says, I knew I was a girl from when I was born. I can't remember ever doing anything else, and my parents let me be a girl. And so her transitioning, the difficult part was finding a doctor to do the surgery at 16. But she said we had a lot of trouble finding a doctor, but when we found one, he said I was the perfect case. And she's now in her early 20s, and I'm very pleased with her surgery in her life. And she's fortunate. She's very pretty. She did it young. So she didn't really go through, or she was 16, so she went through a male puberty. Then she had to go through the female puberty. When children are young and do it, we prevent them from going through both. But anyway, so she's very delightful to talk to and talks about what it was like. And they ask her what it was like. What was it like in grammar school when your name was Tim, not Kim? And she'd say it was very hard. It was very hard, but she had a lot of support, and it worked out really well for her. So if we can keep going. Okay, should I pass all this because of time? Social considerations, I'll make it quick. There's just so much that people have to go through. Basically, I just wanted you to see that it's not an easy path. Basically, think of things that are hard enough for the rest of us. If like going on a date for the first time, or talking to friends, telling them who you are, where you're from. Imagine having to tell someone on a date that you're transgender, or it's really, 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 it can be really difficult. So yeah, so I have a little, I think, I can't hear you, but can we show, are we going to have a little bit more time?
Yeah, so we're set to continue until well, 7:30, but we can
All right,
try
I'm
to
going to
get
keep
as much
going
as we
then.
can.
This is a first date where we can go back to this at the end if you'd like. It's very sweet. He talks to her. It's just the first date, and she tells him that she's trans, and his reaction, and then she narrates it in between, and she says how hard it was that you tell them. She said one line changes everything, and she says, well, and it's me. I'm a trans woman, and he said, oh, I had no idea, and they went because she's very pretty, and so she just talks about the fear and the terror of having a date and having to tell somebody, and what will happen after that. Will it be okay? Will it not be okay? Will they get hostile towards her? It's just, you're just you go through so much, and then you put yourself out there, and it's really, really difficult. So maybe we can come back to that. So, okay, definitions of, self-esteem. That's good, what transgender people want you to know. But self-esteem for most of us is about feeling good about ourselves, and feeling that we have worth and importance. And when somebody discovers they have a condition like transgender, and then they go through everything I just shared with you to get their body in a place where at least people can relate to them, but then they go through all that to look as good as they can, and then people still discriminate just because they look a little bit different, and because people don't understand how painful it is. Nobody asked to be born with the condition of being transgender, but it is something that people say, if I couldn't be the gender I am, I wouldn't want to live, because I would want to die, because it's just pretend, it's just a game, it's just not real. Transgender people want you to treat them with respect, that we're no different than anyone else, mentally or emotionally. It's not a condition of choice in the least. Who would go through all that out of choice? We're not mentally ill. Everything we are is not related to sex. Being transgender is not a flaw in our character. And like non-transgender people, we have various sexual orientations. You don't know if somebody transitioned, or they gay, or they straight, or what are they? They're just like anybody else. It could be a variety of things. But above all, transgender people need to be treated equally. I had a woman I met, she was a trans woman from Brooklyn. She is 30 years old. She had a very successful business in Manhattan, and she looked great. Her hair, everything, she looked great. But you could tell she was trans, whether it was because she was a little too tall, or there was just maybe like 15%, but you could tell. So in the conversation, when I talk to people, they always want to be stealth. Like they say, Denise, do you think do you think I could fit in? And so, this whole movement of we got to fit in, and which is almost is crazy, because it would be like me saying, I have to look like the magazine cover. We're not all going to fit in, especially if you're trans, especially if you change when you're 40 as opposed to 18. So the word stealth came up, and she said, "Oh, I don't want to be stealth." She said, "I'm a trans woman." She said, "All my friends are trans women." She said, "We're proud of who we are." She said, we accept who we are." She said, "So we don't want to look like cis women." She said, "But we want to be treated equally." And I thought that was really a powerful statement and really, really good. So I wanted to share that with you. And it's hard because when people go through all this and they are looking 85%, there's a lot of macroaggression towards transgender people. So I made a list of comments. These are things that people have said to my clients, where you say, "Oh, I'm Susie, I'm trans." And they'll say, "Oh, Susie, what's your real name?" You know, what's the name you were born with? Or, "You're so attractive for a trans person." Or, "You're trans? I would have never known. You look just like a real girl." Or many people just right away go, "Have you had your surgery yet?" Which is very rude. That would be like somebody coming to me saying, "Hey, I have a vagina. Have you used it often? Do you use it often?" I mean, how do people just go right for that with transgender people? But they do. People are very bold with it. Somebody said, "I miss you when you were a girl. You were so pretty." You don't want to hear that when your life has moved on. Someone said, "You're married and you're trans? That must have been difficult." I mean, can you imagine? It's just pretty horrific. So, okay, but yet, okay, no, you can put that one back. That's good. How to respond. Yeah, but I want to read something first. Remember, though, it's not all bad. When people do transition, they feel like, "Oh, I found a path. I found a life. I have friends. I can really be who I am. I'm more clear about respecting other people, where they come from, because I wish people would respect me." They come to realize a strength they never knew. They come to visualize a positive future, because trans people have very positive futures. They marry, they have great jobs, and you have hope that you can get on with your life. But a lot of that depends upon us and how we treat them. So how to respond: be aware and sensitive, show compassion and understanding. Trans people know they're different from cisgender people, so we don't need to remind them. Always use the correct pronouns. If you're not sure, ask what to call them. And avoid, the backhanded compliments would be those micro and macroaggression things I just read. Don't make assumptions about their sexual orientation. Be careful about outing them, because, we just want to respect people's privacy and confidentiality. And be mindful that trans people are living in the same world as you, dealing with many similar issues that we all have. But they're also dealing with the struggle of being able to have the same privilege non-trans people have by being able to express themselves authentically. Okay, so let's move on to the dental practice. Oh, and you can ask yourself, I ask myself all the time, would I have the courage to do all this? I really don't know. You'd have to be in the shoes too, but it's not easy. So, okay, so let's look at the Texas Dental Code of Ethics. We have autonomy. So what would that look like? Okay, the dentist has the duty to respect the patient's rights to self-determination and confidentiality. Therefore, to respect their rights to self-determination, I would say let's use their patient preferred name and appropriate pronouns when possible. Record the patient's gender identity in your records. Make sure the staff are aware of their preferred pronouns. And if unsure, ask them what their preferred pronouns are. Okay, principle of non-malfeasance, do no harm. The dentist has a duty to refrain from harming the patient. Consider your own attitude. This means don't limit, of course, minimize barriers to care, watch discrimination, avoid risks. What I would do for do no harm is ask for procedures they've had with other providers regarding their transition. And ask them, are you out? Are you out, or are you not with your family? Just kind of get a sense, and because they're opening up to you. So, you don't want to do no harm. Are you out? And where have you had procedures, so that you're aware of that, so you don't do any harm. Beneficence, do good. So again, know the facts. Um, Conduct yourself in a manner to elevate the esteem of the profession, which would be knowing the facts. And by that, I think we have to realize that you're so important. That transgender people don't have a hard time because they're transgender. They have a hard time because people don't accept them. And as a dentist, they're always, people don't remember if you've had a lot of dentists, who did my crown, who did this, not often, but you always remember how a dentist treated you or how any professional person treated you. And so I think that the do good and the fairness is knowing the facts and being respectful. Then we come to veracity is truthfulness, which is about trust. And how can a patient really trust you if you don't know who they are? And I think trusting to know that this dentist gets that this is not a choice and that they really want to help me because my mental health affects my oral care. So when I say, I fell off the bicycle, but I had feminine facialization surgery, you will know, you can say, so tell me what procedures did you have done? And where did you go for that? Did you have to go very far? Who did that? How pleased are you with that surgery? Or if someone's having electrolysis, you could say, well, how long do you expect to go? 6 months, 9 months, and where are you in that? So I can keep a record of it with you and know about where you stand with that, because I want to know. Or you could ask the mother, which pronoun do you want? Your child wants me to use this pronoun. If they're a minor, you would share that with the parent. Is that okay with you or not? These are things that you just talk about, because that's going to establish the patient being comfortable, trusting, feeling like, oh, this dentist really knows what they're doing, or they know I'm not a mystery to them. So important, so healing in itself. Okay, I would suggest for the dentist, suggestions for the informed, aware, state-of-the-art dentist, which hopefully you are. Number one, remember that you are very important to the patient. Be supportive. It's okay to make comments and address the elephant in the living room. If you're comfortable, say, hey, how's your transition going? They would love that. Here you are, a professional person asking them how it's going. Use the correct pronouns. If you're not sure, ask. And if you make a mistake, it's okay. Like if you knew them as Bob and now they're Barbara, and you say he, you have to say, sorry. And as long as you acknowledge it and smile, they'll smile too. But if you just, so people are pretty willing to go with you if you're willing to work with them. Ask, is there any way I can help you with your transition regarding your dental needs? Just regarding your dental needs, just see, they might come up with something that you haven't thought about. Adjust your forms regarding sex and gender. Consider adding a gender mental health history, which I think is very important, and help support staff to be sensitive. So if you say, hey, that's a good idea, a gender mental health history, can you go to the next slide, which is suggestions for the dental office. Okay, design a medical health history form for transgender clients. Okay, change your gender choices I've outlined it for you to make it easy. Change your gender choices on your intake form to say male, female, gender non-conforming, or non-binary. Ask what name what's legal name you go by. Get a list, this is just a separate form, procedures that you have already had regarding your transition. Have you had surgery, electrolysis, laser hair removal, hair replacement, hormones? Or get a list of procedures that they're planning to have. So if you see them for something and in 3 months I'm going to have my Adam's apple and my nose done, then if you see them 6 months later, you might make a comment about that. You'll have that in your record and they'd be like, oh, they remember, that's really great. They're with me on this. Get a list of other health providers or support systems involved in their treatment, doctors, therapists, support groups. Ask if they're out to their family, friends, coworkers. Are you out to people? You might want to note that, especially if you're seeing other family members. So there's just so you know that. If they're female to male and they're young children or even adults, I would ask if they're binding. I mean, if I was doing a dental procedure, I would think, especially if you're giving someone a twilight or something, don't you watch their breathing? If somebody's binding, you're not going to see them breathe. It's going to be very, very shallow. So I think it would be a great thing to ask, are you binding? And they will be happy to tell you. They'll be happy that you even know about it. And then ask, is there anything else you'd like us to know about you or your transition to make your dental care more comfortable for you? I highly recommend you have a medical health history for transgender patients. I think it would be great for you, for them, and kind of show that we do care about all people and we are non-discriminating and we are aware of some of the things transgender people go through, and we are proud to service them and treat them like equals and everybody else. Okay. What does it take for the dentist to do this work? Well, compassion, empathy. Again, it could have been some of us. I mean, it could have been me. I think, I didn't know that I wasn't going to be transgender. It just kind of, it's there for some people. Objectivity, awareness and knowledge, and integrity with yourself. Really being able to feel good about yourself, that I want all people to be comfortable in my office and I want them to feel like I recognize them and value them for who they are. And I think that shows great professionalism to be that way. So that's what it takes for the dentist to do this work. So I want to open this up to questions and answers, and stick around if anybody wants to see the dating video or the last video that I have. I would be happy to show that.
Okay. Thank you very much, Denise. We do have a few questions in the chat room already.
Okay.
So let's see, we will start with Anna Monet, who is asking if you can explain non-conforming versus non-binary again.
What was the first one before non-binary?
Non-conforming.
Okay, so non-binary would be, binary is male or female. So if someone's non-binary, it means they don't really relate to either one. And non-conforming is the same. Okay, I'm not non-conforming, I'm not conforming to either one. So some of the terms have overlap, and that would be one that does.
Okay, so the next question that was asked, Elizabeth is asking, can you explain binding again? What
binding is when a female-bodied person flattens their breasts so that they are, because they're in a transition, they want to look more male. So they may be dressing male and have the short hair and really looking male. And if you're a, double D, it's not going to go over really well. So they bind. Some people used to use, I don't know, now they use like sports bras. There are t-shirts that are binding, flattening, that you can get online. There's a whole wardrobe of trans everything, clothing, everything. And you can get binding bras and t-shirts to flatten. And that's what binding is, flattening yourself. Yes.
Okay, let's see. So our next question is from Sue Keller. Hi, Sue. So she's asking if there are any dental or perio implications to testosterone or estrogen treatments. So essentially, if you know of any oral health manifestations of taking these.
No. Good question. No, nobody's ever said that they have had any negative oral problems from the hormones.
Yeah, and as far as I know, Sue, I know that's kind of something newer in the research. I've been trying to, investigate that a little further. So that's kind of something I'm looking into a little bit more. But as far as I know, something that has been really reported substantially.
Well, I was just curious because if people are pregnant, oftentimes the pregnancy hormones end up with gingivitis of some sort. So I didn't know if all of a sudden loading a lot more estrogen than someone was used to into the system might do something like that.
Yeah, great question. I have had people take high doses of estrogen and they haven't complained about anything like that.
Good to know. Thank you.
Yeah, you might want to look up and get more medical background on that, but I haven't had anybody say anything. Yeah.
And so looks like Don Cohen is asking if you can I think there was a typo in the message. So I think he's asking if you can discuss what cis means or describe what cis means. Oh, explain what cis is defined as.
Cisgender is the opposite of transgender. Transgender means your mental vision of who you are doesn't match your sex at birth. Cisgender is when it matches. So most of us are cisgender in that our sex at birth matches how we mentally feel about ourselves. Okay, so it's when it all matches, then they say we're cis. Okay, and transgender people are the opposite of that, doesn't match.
So some also just to add to that, a way I like to think of it, you know, we're all in the dental world here, so we all took chemistry at some point, organic chemistry. So I just think of cis and trans chemical bonds. Cis match, trans are opposite. So that's really when your gender doesn't match your sex assigned at birth. So easy way to.
Interesting. That's helpful.
Mm-hmm. So any other questions? Y'all can type in the chat as we continue. And
could I ask a question? Sorry, mine's kind of long, so I didn't want to type it all.
Yeah, go ahead. Is this Eddie?
Yeah. So
okay,
I'm a practicing dentist in the state of Oregon, and I'm lucky to work for a federally qualified health center that actually helps patients with their transition process. But some aren't out, so we do have a medical health history where they select, you know, how they identify, but oftentimes they don't identify on that sheet as trans, but on their record, which I have full access to medical records, it does show they're in the process of transitioning. Is it correct or polite for me to address them in their now new identity, or should I stick to their original identity if they're not out yet? Does that make sense?
So they have a new identity.
I don't want to out them.
Uh-huh.
So on their paperwork that they come into my office,
Yeah.
they mark, you know, cis male.
Yeah.
But in their epic charting, they're transitioning to female.
Right. So when
I don't want to out them.
Right. So I would ask them. I would say, what name do you want to be called by, and what pronouns do you want me to use? I would. That's why I think on the gender form that I'm suggesting, it asks that. You know, what name do you go by? Because if somebody's transitioning, yes, he's legally still male, but maybe a lot of people, he's in a social transition. Maybe he's even started, you know, everybody's calling him by his male name. I would think he'd want you to call him by his male name as well. Right?
Yeah.
Yeah, nobody wants you to call them by their old name if they have a new name, because the old name they consider my dead name, and nobody wants that. Yeah. So if you say, are you saying he hasn't told you that he's making a transition? You just read the
Yeah. So he hadn't told me, but on the record, I knew that he preferred to go by she.
Well, that's perfect, because you have substantial evidence. So I would say, I need to share with you something I noticed in your records that I read this, and I'm on board. Would you like me to call you she, use the she pronouns, she, her pronouns, and what name would you like me to call you? Yeah, because it's right there. I would.
Thank you.
Say no. Yeah, I can't say no, but I doubt it. I think it's really hard for some people. I don't know if you have a sense that it would be hard for this person to come out to you, but it's really hard for some people.
Makes sense. Thank you.
So afraid of rejection. Thank you.
Yeah, thank you, Eddie. So Dr. Monet is asking, at what age should we start kind of asking these more specific health questions with someone that is transgender? As that can get a little bit tricky when maybe someone is a minor, maybe they are independent from their family, or maybe we're not sure where in the transition process they are. But when should we ask a patient those more, you know, detailed health history questions?
That is a good question. I was thinking about it in terms where the patient could respond on their own, right? So yeah, you could do it with somebody like 18 and over, unless they're a teenager. I guess if somebody doesn't come to you, I mean, probably wouldn't have it for every patient that comes in your office. or you could put a line that we have a separate mental health, a separate form for transgender clients. Please request if you would like us to have this information. So I mean, if you're young, if you have children, if the parents aren't sharing it with you, I wouldn't bring it up. I would use it for people who really want you to know. And I guess the way to do that, you have to think about it. How would we get that? I mean, I'm just thinking so many people come out and tell you I'm trans, and then you can say, great, could you please fill out this form and give me more information? Or you can just put on your forms, if you are transgender and would like to share that with us, we have a health history form we would like you to share with us so we can know where you are with your transition. Then I think most people would go, oh, they're interested. Okay, I'll tell them and get that. It might be a way to open up. Maybe you just have it at the bottom for your adult patients. How does that sound?
Yeah, thank you, Denise. And just to add to that, maybe from a clinical perspective, you know, you as dentists, we feel confident in asking the information or the questions that you need to practice safely and ethically. If it's something that is not a consideration with what you are going to do to them that day or with how you're going to treat that patient, you don't have to ask. You know, you can always, like Denise said, let the patient know that you are understanding and kind of educated, and make them trust you, or allow them to trust you, and that way that can open up the conversation. But all you need is the information that you need for the dental procedures that you're doing as a dentist.
Okay.
Okay, and so we are kind of running out of time. I will kind of read a message from Sue here. She's saying, thank you, Denise.
Oh, and I just want to say, yeah, if you have any questions, you have my email, right?
Mm-hmm.
It was on the homepage. Please feel free to email me with any questions that you have in the future, anything that comes up. I'll be happy to help.
Yes, and yeah, so we'll transfer Denise's contact information, and you all will have mine as well in case you have any questions. I'm just going to transfer it over to Cynthia to close us out for the day. Cynthia.
Thank you so much, Alex. And thank you so much, Denise. I'm part of it, and I learned so much tonight, things that I had no idea about. So thank you for joining us. Thank you for presenting. On behalf of the Houston Equality Dental Network, we'd love to host you again.
Thank you. I would love it.
And I'd like to also thank the attendees. We had 67 people attend. Your success. And once again, thank you again, Denise.
And thank you for your patience. Now that we're all on Zoom, it's a little bit difficult sometimes, so I appreciate your patience. Maybe we can do it again and show more videos.
Yeah, definitely. So thank you, everyone. Again, you can have my contact information if you have any questions, and I will send you Denise's information as well. Thank you for participating. We'll send out an email in the next few days about the CE credit. Oh, and the code that you need to know for the credit, I typed it in, but the code is equality. So just write that down in the corner. But again, I have your email, you have mine. So we'll chat soon. Thank you, everyone.
Thank you. Bye.
Thank you. Bye-bye.
Bye.